Dear students, welcome back. In the previous session we have discussed about Q angle. Now in this session we are going to discuss about effects of injury and disease to the knee complex. As we know that knee complex includes knee joint as well as patellofemoral joints. So now in this session we are going to discuss about both knee joint injury as well as patellofemoral joint injury. Like the joints of the knee complex, like other joints in the body, are subjected to developmental defects, injury and disease processes. However, there are a number of factors that make the knee joint unique. So the knee, unlike shoulder and wrist, must support the body weight, and at the same time it provides mobility. Although the hip and ankle joints similarly support the body weight. The knee is the more complex structure than either the hip and ankle. The knee joint also joins two of the longest livers in the body and is located in a more exposed position than either the hip and the ankle joints. Okay, so such kind of importance is there for this knee complex. Now we will see the knee joint injuries. Okay, so normally mainly here the people who are participating in physical fitness and sports activities currently among all age groups and in both sexes is subjected to knee complex to an increased risk of injury. Sports such as jogging, skating, skiing, football and tennis may cause either direct or indirect injuries. Okay, injuries to the knee complex may involve the menisci injury, okay, and the ligaments and also the bones or the musculotendinous structures. Here in this pic you can see the meniscal injury. Meniscal injury especially of the medial meniscus. So here you can see this medial meniscus tear here. Okay, yes, you can find here this is the tear. Yes, so how this occurs means normally it is a very common type of meniscal injury and usually occurs as a result of sudden rotation of the femur on the fixed tibia when the knee is flexed. When the knee is flexed, there is a sudden rotation of femur on the fixed tibia which causes medial meniscal injury. Okay, axial rotation in the flexed knee. Okay, axial rotation in the flexed knee occurs when the medial meniscus acts as a pivot point. Okay, the more rigidly attached medial meniscus may tear under the sudden load also. Okay, this is about the meniscal injury. Now we will move on to the ligamentous injuries. So here we can see the ligamentous injuries in this pic. Ligamentous injuries may occur as a result of a force that causes the joint to exceed its normal range of motion. A blow to the lateral aspect of the knee or the tibia may cause a valgus stress, thus results in tearing of the ligaments restraining valgus motion, which may cause the medial collateral ligamentar as well as the ACL. Likewise, forced hyperextension of the knee may cause tearing of the posterior ligaments. Although excessive forces may cause ligamentous tears, lower level forces may similarly cause disruption in ligaments weakened by aging, disease, immobilization, steroids or vascular insufficiency, which are also the causes for this ligamentous injury. Each of these may affect the collagen or ground substance of the ligaments. Cyclic loading, whether short term or intense or over a prolonged period may also affect the viscoelasticity and stiffness of the ligaments. A weakened ligament may take 10 months or more to return to normal stiffness once the underlying problem has been resolved. So here you can see the MCL ligament along with ACL, and also only some tear in the medial collateral ligaments, and you can find the lateral collateral ligament. That means if varus stresses are increased, then there may be a cause of torning of this lateral collateral ligaments. Okay, and also the bony and cartilaginous structures may be injured either by the application of a direct force, such as bumping the patella or falling on the knees, okay, or by indirect forces that are exerted by abnormal ligamentous as well as muscular forces. Okay, so all these causes bony as well as the cartilaginous injuries. And knee joint instability as frequently seen in the knee following ACL injury can lead to progressive changes in the articular changes as well as the meniscal changes. That means if ACL is not present, there may be probable translations on the AP direction. So there may be wear and tear of this cartilages as well as the menisci, and the ligaments, the other ligaments has to work overload to compensate the anterior cruciate ligament function. So the other ligaments attempting to restrain the increased joint mobility. Okay, so all these changes are going to occur if ACL is getting injured. Okay, and around the knee there are numerous bursae and tendons at the knee are present, and which are also going to subject to injury. The cause of injuries of these structures may be either a direct blow or prolonged compressive or tensile stresses. So this one is one of the thing, that is housemaid's knee. The bursitis most commonly occurs in the prepatellar bursa and also superficial infrapatellar bursa, so which is known as housemaid's knee, but may also occur in high friction areas such as at the bursa beneath the pes anserinus, so that we can see on the medial aspect of the tibia. Okay, the localized tenderness generally associated with bursitis may be found if the fat pad between the patellar ligament and the anterior synovial membrane becomes inflamed. That we can see inflammation. This is the inflamed prepatellar bursa we can see. Okay. So another potential source of pain and dysfunction in the knee joint is the presence of patellar plicker. So this patellar plicker, and which here you can see, this is an extra foldings of the synovial membrane. We have already discussed about this plicker. Okay, so the classical symptoms include pain with prolonged sitting, with stair climbing, and during resisted extension exercises we can feel this patellar plicker syndrome symptoms. Okay, more than half of the patients will also complain of a snapping sensation. Okay, in flexion, the plicker is drawn tightly over the medial femoral condyle and pressed under the patella. Okay, the resultant tension in the band may cause patellar misalignment leading to pain, or the plicker itself may become inflamed. If the inflamed plicker becomes fibrotic, it may create a secondary synovitis around the femoral condyle, and deterioration of the condylar cartilage occurs. So these are all about different kinds of knee injury. Now we will move on to the patellofemoral joint injury. So this so we have already presented a number of problems which are related to the knee joint injury, also causes injury to this patellofemoral joint, causes patellofemoral dysfunction. Any one problem in isolation or various combination of problems, which may include primary and secondary changes, may lead to excessive pressure on the lateral facets of the patella. So normally lateral facets of the patella is going to affect to lateral subluxation or to lateral dislocation. Whether excessive pressure, subluxation and dislocation are separate clinical entities or part of a patellofemoral dysfunction. However, we can see commonly associated with knee pain, and in such kind of patellofemoral joint injury, the patient will have poor tolerance of sustained passive knee flexion as the person is sitting for longer periods, and the patient experiences giving away of the knee and exacerbations of symptoms by repeated use of the quadriceps on a flexed knee. These symptoms are similar to the complex of symptoms found with the Petalar Plicker, which may occur as a related disorder. Okay, here we can see the inflammation of the patellofemoral joint here. Okay, and also when patellar subluxation or dislocation is present, tenderness of the medial retinaculum and medial border of the patella develop with repeated subluxation or dislocation. The medial retinaculum is stretched as the patella deviates towards or slips over the lateral aspect. Okay, over the lateral aspect, that is lateral lip of the femoral sulcus or condyle. The return of the patella into the intercondylar notch may impact the medial patella. So occasionally it may cause in the condition called as osteochondral fracture. Okay, and some of the conditions like any cartilaginous changes seen in the lateral patellar facet were considered to be the diagnostic of patellofemoral dysfunction, and the term for this is chondromalacia patella. So the condition name for any cartilaginous changes on the lateral patellar facet are considered to be one of the patellofemoral dysfunction, and it is termed as chondromalacia patella, means softening of the cartilage. Okay, so and many problems like minor structural and stability or overuse problems, which are also found among adolescents and young adults, may cause patellofemoral pain. And if it is not treated properly, it may lead to osteoarthritic problems. So this is all about the knee complex injuries. Thank you.